Hey everyone, Dr. Alex here, and we're a little late starting our live video for today, but I'm glad we can make it happen. Room's a bit bare, we're in the middle of a move, but we're going to talk about another subject from a discussion I had with a patient this week. It's a discussion I've been having with patients for weeks and weeks and years, and that is the cause of their low back tightness, most often in reference to when we're speaking to patients about exercise. But this typically applies to almost all low back pain sufferers that we see in the office that come to us with spine problems. And part of their spine problem almost always arises from the following issue, and that is that their low back muscles are doing too much compensation, too much work, getting overloaded because the glute muscles, the big hip muscles, they are not doing their job. So in brief, what happens typically with a lack of exercise, with an unhealthy spine, with too much sitting, whatever the problem may be in somebody's case, the glute muscles, the hip muscles, they typically stop doing what they're supposed to do, which is to bear most of the load of the trunk and the core. So when somebody's squatting down rather than using their glutes, they end up using too much back muscle. When somebody is moving around in their day, they're using their smaller back muscles instead of the big glutes. When somebody's exercising, they might not be coordinating things properly. And what's most important, rather than the specifics of each case, is that the low back muscles are not typically meant to be big movers of the trunk. Yes, they do move the spine, but they're really, really good at keeping the spine nice and stable, making sure it doesn't move around, make sure it stays nice and tightly compacted and stacked up. Whereas the glutes, which might be 3, 4, 5 times, 6 times as big, they should be doing most of the movement, especially when it comes to bending at least the trunk a little bit backwards, but most importantly for extending the hip or taking any load with bending. So we want to make sure that we're activating and turning on those glutes. So if somebody has a problem with their spine, we often will notice that the nerves that activate and talk to those glutes, they usually don't fire properly or turn on properly, and we inherently see some weakness. Sometimes this is something in the office that no matter how much you try to rehab it, no matter how much you try to strengthen it, it just doesn't get better because the brain-body connection is not that solid, and that's where making sure with good chiropractic care, sometimes some acupuncture, that those nerves to the glutes, they start turning on properly. It's almost requisite to have a good, healthy spine. But what I want to go through today is to make sure that everyone understands that if somebody's getting a lot of low back pain tightness, if somebody's getting low back pain, the thing that we want to make sure that's not happening is that it's not the glutes failing to do their job, and that it's not the low back muscles doing too much work, too much compensation. So we're going to give a couple of cues and a couple of exercises down in the comments to work on. So cue number 1, when we are moving about and moving around, we're doing some exercise, we want to make sure that primarily, especially with something like a squat, or most often with a deadlift, that we're really using our butt muscles and not our back. And so the cue I use most often to turn on the gluteus maximus, or the big butt muscles, is to squeeze the glutes or the butt cheeks together like you're holding a penny between your buttocks, or a penny between the butt cheeks. That is a good cue that most people can do, where they can turn their glutes on. Another cue that's useful is to pretend like you're having sex and to thrust forward, and that will, number 1, stack up and straighten up the core, but that will turn the glutes on. Typically that's going to activate the gluteus maximus, maybe a bit of the gluteus medius, and that's a good cue to think about if you're doing some exercise in the gym, or if, say, you're lifting something. If you're doing a squat, for instance, we want to make sure that you do a little bit of an activation or a cue, and then when we squat down, we're not coming down over the knees, that we're sending our butt backwards without falling, that we're sending our butt backwards, and then we can feel the load through here. So that's one cue that I like to give people to make sure that they're activating their glutes, and that when they're lifting something, that they keep their abdominals nice and tight, and that when you lift something, it's in here through the butt. You can clench the butt cheeks, and that is going to help to make sure that when you're bending backwards or lifting something, you're activating the glutes and not the low back muscles. The other cue that's really, really, really important, especially in running or anything with side-to-side movement, is making sure we can activate the glute muscles on the side of the hip. So a lot of people we see when we try to teach them a standing fire hydrant, and I recommend you guys do this right now. If you get down onto, so you stand on a single leg, you squat down a little bit, you feel the load in the glute. Now see if you can lift your leg up without moving your trunk. You should be able to move just the hip, and that would be the gluteus minimus and medius. And so that's where you lift the hip out to the side without moving your trunk. If you use it with a resistance band, it's a little bit harder. From this angle, you can see that hip coming straight out to the side, and my core doesn't move. If you try this and you notice that when you go to do it, that you have to really rotate the body, or you're unable to just move the hip without moving your spine, that might be a sign that you're using too much low back muscle and that you're not able to independently move your hip. So you want to make sure that you can just move the hip. The easiest way to practice this, the easiest cue for this, to learn this, is when we lie on our side and we just practice a simple clamshell maneuver. So you pretend I'm lying on my side, and we'd be practicing a clamshell with just activating the hip, keeping that core nice and tight. If I were to lie down on the couch, you could say core nice and tight, keep the shoulder and hip stacked up, and you lift that leg, hand on your trunk, make sure that you're not using that low back. So when it comes to activating the glutes, the cue for the gluteus maximus is to clench those butt cheeks together to make sure that when we lift or do anything that we're not extending the low back. That will help to retrain your spine so that when you're going through your day-to-day activities, you're using those glute muscles, not the back. For the side-to-side motion, gluteus minimus and medius, that clamshell is a really great introductory exercise to make sure that you can turn that muscle on and move your hip independently of moving your spine. That is a fundamental requirement for having a healthy spine. If you notice that you can't do it, that you have to move the low back, that's where we're working with a professional. And this is one of those cases that you might be a trainer in your neighborhood, but if working with a trainer, if that doesn't help, if you just can't get those glutes to fire, it probably reflects that there's a problem with the spine. So the clamshell is a great tool for that. And then the more advanced version would be that standing fire hydrant. So I hope that was helpful, everyone. Keep in mind that if you're getting lots of low back pain, tightness, it's probably because you're using the low back muscles too much or not in a way that they were designed or have evolved to be moved. If it comes down to sitting, it's usually because you're sitting too upright all day using these muscles. But if it is with movement, with exercise, or going for heck just to walk around the city, it's usually because those glutes and those butt muscles are not turning on. Try those clamshells, try the standing fire hydrant, try clenching the glutes, squeezing that penny, try sitting back into a squat, see if you can feel that load in the glutes. If you can't, get your spine checked, make sure that it's not a problem with the spine, creating issues in the hips and the low back. As always, I hope it's helpful. If you look in the links, I'll have some of the videos and some of the activation exercise I talked about in the video we just went through. And until I see you guys next week, take care, be safe, stay healthy.